It's an absolute pleasure to be back in Ireland. Dublin is almost starting to feel a bit like home. Health equity, children and young people. I've been thinking about what it is that I do in this difficult political context in which we find ourselves. One would not have thought that one had to talk about the importance of truth. Wow, what a radical idea. Tell the truth. Justice, surely that's what motivates everyone in this room. That sounds like a quaint idea. Distinguished visitor coming to Ireland, not me, President Zelensky, fighting for justice. And in the current negotiations over Ukraine with Russia, has the word justice arisen between the presidents of the United States and Russia? And hope. It all feels a bit hopeless. So this is my theme as I look back on what I've been doing and I look forward to what we are doing. Truth. Truth has two components in my mind: the evidence, what does the evidence show, and speaking truth to power. My book, The Health Gap, summarized the evidence, the opening line of which was, why treat people and send them back to the conditions that made them sick? When people think about health and health inequalities or health equity, usually they think about the health care system. When the OECD or the IMF or the World Banks talk about spending on health, what they actually mean is spending on health care. But I'm concerned with the conditions that make people sick, the social determinants of health. I will talk about the UK context where we've been working, mention Ireland, but much of it is relevant to the Republic of Ireland. So based on the review that I did, just a little bit of history, as you heard, I chaired the World Health Organization Commission on Social Determinants of Health. We published our report in 2008, and we made a virtue of necessity. We were trying to deal with social determinants of health in 193 member states of WHO, and they're very different. So we said it was very important to take the principles and adapt them to the relevance of particular countries or sub-areas, which is what we've been doing, and I'll get to that. In the UK, the then Prime Minister, Gordon Brown, asked me to answer the question, how could we apply the findings and recommendations of your global commission to one country, England? And he commissioned me to do a review, which we published as Fair Society, Healthy Lives, the Marmot Review, in 2010. In 2020, on the 10-year anniversary of the original Marmot Review, we published Health Equity in England, the Marmot Review 10 years on, and we looked at what had happened in the previous 10 years. Spoiler alert, wasn't good news. And we reiterated our 6 principles: give every child the best start in life, education and lifelong learning, employment and working conditions. Number 4, what a radical idea. For a rich country, everybody should have enough money to eat and have shelter, the minimum necessary for a healthy life. Number 5, healthy and sustainable places in which to live and work. And number 6, taking a social determinants approach to prevention. We've added 2. I wanted to keep it simple to 6, but necessity. tackle racism, discrimination, and their outcomes. And number 8 was really there all along. Pursue environmental sustainability and health equity together. After the global financial crisis, I'll come back to the previous slide, we had a problem. Life expectancy had been improving about 1 year every 4 years. This graph starts at 1999. I could go back to 1919, at the end of the First World War. Life expectancy had been improving about 1 year every 4 years. In 2010, there was a break in the curve, and the rate of improvement slowed, and then it fell with the pandemic, the first 3 years of the pandemic. So we had a 14-year period where life expectancy did not improve at all. If you agree with my assumption that the health of the population tells us a great deal about how well that society is meeting the needs of its members, it meant society was not improving for 14 years. Not shown here, health inequalities got bigger. And life expectancy declined in the poorest areas. The consequence of 14 years was health stopped improving, health inequalities got bigger, and health for the poorest people got worse. What happened in 2010? Well, we had a new government elected, and I hasten to add, I'm not party political, at least overtly. The number one priority of the Conservative-led coalition government was reduction in public expenditure, roll back the state. And they did, by golly. In 2009-10, public sector expenditure was 42% of GDP. It went down year on year. By 2019-20, that 42% had become 35%, 7% of GDP per year. With a GDP of about £2 trillion, 7% a year is about 170, 180 billion pounds a year taken out of public expenditure. If you think that was all waste, then there would be no ill effect. But if some of that public expenditure, like children's services, elderly care, health services, community development, housing, if some of it was doing some good, it wouldn't be much of a surprise if you damaged the well-being of people, and that would show up in the effect I've shown you on health. In the first year of the pandemic, public sector expenditure went up. The Minister of Finance of the day, there's no way you would remember who that Minister of Finance was, but since the Brexit referendum in 2016, by 2024, we'd had 7 Ministers of Finance. Utter chaos! That Minister of Finance became one of the 5 Prime Ministers we had since the Brexit referendum. Utter chaos! The country wasn't governed, which may have been a good thing, because when it was governed after 2010, they said about slashing the state. They were too busy deconstructing to do too much more damage. I'm not party political, I'm just speaking truth to power. So the Minister of Finance said, whatever it takes, we've got a pandemic with big economic consequences, whatever it takes. And I thought, back in 2010, the Minister of Finance, the Chancellor of the Exchequer, didn't say whatever it takes. He said, it's a moral necessity. It's an economic imperative to cut public spending, with all the damage that subsequently it did. Health follows a social gradient. It's not just that poor people have poor health and everybody else is fine. People like me have always been saying, oh, you know, poor people have life expectancy that's 15 years shorter than the rich, and we're always focusing on the poor. And I said, let's look at the health of the rich. I don't mean water skiing accidents while on holiday in Barbados. I mean the life expectancy of the least deprived tells us what's possible. Let's make the assumption that if everyone in the population had the deprivation level of the best of, they'd have the mortality rates of the best of. So everything below that is excess. And what you can see, if you're a bit more deprived, some excess, bit more excess, all the way down because of the social gradient. So we calculated the excess deaths over the decade from 2009 on to 2020, linked to deprivation. And in total, there were 1 million excess deaths linked to deprivation. If everybody could have had the deprivation level of the least deprived, arguably there would have been 1 million fewer deaths. Now, there was a social gradient pre-2010, but it got steeper. The inequalities got bigger. And we calculated the excess deaths, arguably linked to austerity. And the number was 148,000. It's a reasonable presumption that austerity killed 148,000 people. Colleagues in Scotland wrote to me and said, you've underestimated the impact. We calculate it was 300,000 deaths. Okay, we said austerity only killed 148,000. It was probably more. Justice. I mentioned to colleagues this morning, we've been talking about proportionate universalism. I was trying to combine two ideas. Typical British social policy, perhaps Irish, is you target the worst off. A more Nordic approach is you have universalist social policies. So I said, let's combine them. Let's have universalist policies, but with effort proportionate to need. So if this is the social gradient, less deprivation, better health. If you focus only on the worst off, you may improve them, their health. But what about the people who are above the threshold of intervention, but have worse health than those above them? You can see why I'm not a politician. You know, can you imagine putting on a banner, what do we want? Proportionate universalism. When do we want it? In the fullness of time. You know, it's not going to work, is it? What did we get post-2010? My colleagues and I plotted life expectancy for every local area in England in 2010 to 12, and then looked at the subsequent reduction in local government spending power up to 2020. The cuts were savage. central government's support for local government went down by 59% over the decade. But what you can see here is the shorter the life expectancy of a local area in 2010-12, the steeper the subsequent reduction in local government spending power. I look at this and think the kindest explanation I can give for this is absent-mindedness. They didn't know what they were doing. Incompetence. That's the kindest explanation. But it looks pretty systematic. The sicker the area, the more money we'll take away. That's the opposite of proportionate universalism. That's effort inversely proportionate to need. In what moral universe could that be the right thing to do? If you had a principle of social justice, you would do the opposite of that. It looks like a deliberate policy to make poor people sicker, to make sick communities sicker. Social justice, do we need some reminder that that might be a principle of good government? Not terribly global, but looking at the United States and what they called 19 peer countries, the US did very badly in the pandemic. It handled it very badly, so badly that they re-elected the president who handled it so badly. Scratch my head. I'm not party political in any way. So the US life expectancy fell, and that's quite something because I showed you that the UK was not doing well. In the decade after the global financial crisis, the UK had the slowest improvement in life expectancy of any major rich country, except the United States did worse. I really love the US because on every metric that the UK looks bad, the US looks worse. And their life expectancy, starting from a low level compared with other rich countries, you know, the best country in the world has the worst life expectancy of any of the rich countries. And then it fell. There's Scotland, Northern Ireland, Germany, England and Wales. I don't think I've got Ireland on this graph. But we did really badly. We didn't do as badly as the US. And what's interesting is that the countries that did badly during the pandemic were not doing well in health before the pandemic. This is change in healthy life expectancy at birth from 2010 to 2019, compared with excess mortality during 2020, the first year of the pandemic. So Denmark, Finland, Slovenia, Hungary, Norway were doing well pre-pandemic and had negative excess. They didn't have an increased mortality during the pandemic. The US was doing really badly pre-pandemic. The UK was not doing well pre-pandemic and had a big excess in the first year of the pandemic. So being unhealthy before the pandemic was a predictor of doing poorly in the pandemic. And I would argue being unhealthy pre-pandemic was because countries were not taking action on the social determinants of health. This is a conference about children. You were wondering when I was going to start to talk about children. But I was giving you the context that we're doing really badly. Our number one recommendation was give every child the best start in life. I've been concerned with intergenerational equity. The weekend before last, I was looking at research from the Pew Research Centre. What else is there to do on weekends but look at research from the Pew Research Centre? Globally, most people think children will be worse off financially than their parents. In the UK, only 19% of people think their children will be better off than their parents. What have we done? And the UK is not uniquely miserable. France, Italy, Spain, Greece, Netherlands, Hungary, Sweden. Wow. Now, in low and middle income countries, things are bad, and they think their children will be better off than their parents. But in these high income countries, it's not the case. And in the UK, 19% of people think their children would be better off than them. We are failing a whole generation. One way to look at children's life chances is social mobility. In general, rich parents have rich children when they grow up, and poor parents have poor children. The reason for inequalities in the next generation is inequalities in this generation. Parents pass their privilege and advantage onto their children. They may pass it through inheritance, but they pass it because their children go to good universities and have good chances in life and have more money and buy houses and the like. So social mobility asks the question, the way this question was asked, at the current rate of social mobility, how many generations would it take to get from the 10th centile of income to the median? In Denmark, it would take 2 generations. In Sweden, Norway, Finland, would take 3 generations, the Netherlands 4. In the UK and the US, it would take 5 generations. In Brazil, 9. Why this huge difference? By and large, 2 kinds of reasons. One, the level of poverty. It's what we're talking about today, affecting children. And second, the expenditure on early childhood. How much do we value early childhood? How much are we prepared to spend? And the level of poverty is related to inequality. I was giving a talk at a WHO Euro meeting, 53 member states, and I said, where would you like to be? Heading towards Denmark or heading towards Brazil? Because I can tell you, we're heading towards Brazil. As inequality gets worse and our failure to deal with poverty, only 19% of people think their children will be better off than them. We're heading to Brazil, reducing children's life chances. At risk of poverty, I think, is defined as having an income less than 60% of the median, which is what we call relative poverty. Children 0 to 17 in Ireland have the highest poverty rate of any age group. In many of our countries, it used to be the pensioners, but now it's the children that have the highest rate of poverty. That's at risk of poverty, and consistent poverty is relative poverty plus some measure of deprivation. if we look at change in the relative poverty measure, in fact, Ireland looks better than the average for OECD countries. There's been some improvement between 2012, 14 and 2019, 21. The UK has had the biggest increase in child poverty of 38 predominantly rich countries. Wow. And it's a direct result of government policy. Coming back to Ireland, enforced deprivation rate. This is here so I can read it, not so that you can read it. The deprivation is doing without 2 or more of 11 items: 2 pairs of shoes, a warm waterproof overcoat, new clothes, having a meal with meat, and so on. The kind of thing that's poverty in the 21st century. One adult with children under 18, heavens, 45%, 23 years. If you're a single parent with a child at home, the chance of being in poverty is nearly 1 in 2. How are these children going to have a good start in life if half of them are growing up in poverty? And 2 adults with 1 to 3 children under 18, it's still getting on for 20% in poverty, but at least it's not that astonishingly high level. And one of the consequences of deprivation are adverse childhood experiences, and they all follow the social gradient. These are English data. Incarceration of parents, drug abuse, sexual abuse, alcohol abuse, domestic violence, physical abuse, mental illness, verbal abuse, and parental separation. The greater the deprivation, the greater the likelihood of these adverse childhood experiences that have a dramatic impact on children's mental health and physical health. I apologize for this terrible slide, but the data are important. This is from the Millennium Cohort Study, looking at age 17, at 4 outcomes: cognitive disability, poor adolescent mental health, socio-emotional behavioral problems reported by the child and the mother. Low poverty and good parental mental health is the benchmark. Poor primary caregiver mental health, increased risk of these poor outcomes. Persistent poor secondary caregiver mental health, persistent poverty, and poverty and poor parental mental health. You see the increased risk of these poor outcomes. I said child poverty, inequality, is one of the drivers of social mobility, and the other is how much we invest in children. This is cash benefits and tax breaks and childcare, so it's spending on children 0 to 5. The OECD average is around $7,000 per child per year. In Norway, they spend around $12,000. Germany, Denmark, Sweden, France, Finland. The average is around 7. The UK is about average. Ireland, about the UK. Average, not great, but not terrible. I told you I like the United States. They're at around 4,000. And Brazil's not here, it's not in the OECD, but Mexico is in the OECD, and Brazil's probably down around that level. So spending on early childhood is really rather important, gives children a better start in life and a better chance to get on. And poverty makes a difference, as I've been showing you. This is from UNICEF. No poverty, one-off, intermittent and persistent. Low word recognition at age 14, so not very good on verbal skills. Poor or fair health. Emotional and behavioural difficulties, depression and low subjective well-being. It's not very good growing up in poverty. Not very good for anything. Obesity prevalence by deprivation. Low deprivation, high deprivation, childhood obesity in year 6. And it's not just the poor kids versus the rest, it's a gradient. The rise in childhood obesity has leveled off in the least deprived, but it's continuing to increase in the most deprived. Obesity tends to track through the life course. So we've got an epidemic coming down the track in inequalities in obesity. A recent European study was looking from the European Social Survey, changes in poor self-reported health in high and low education group. So here, a high score is a bad thing. It's poor health. And you can see low education, high education, low education 2024, low education 2014, and high education 2024, high education 2014. You can see the dramatic difference between educational groups. As I said, a high score is poor health. So low education, poor health, and quite big differences. Ireland looks pretty good here. Big differences among countries. But in every country, the low education group have a greater likelihood of reporting poor health. And one gets the impression that the international differences are bigger for the low education group. So it's a combination of where you live and your level of education. I also have the impression that in general, the increase in poor health was bigger for the low education groups. So that was the increase in poor health in Norway for the high education. That was the increase for the low education. In Poland, the increase in poor health for the high education, the increase for the low education. Why am I talking about cold homes? Well, one of the aspects of deprivation is being in a cold home. Why is being in a cold home relevant to our deliberations today? Because children growing up in cold homes have their lungs damaged, do less well educationally, have increased risk of mental illness. When I spent a year as president of the British Medical Association, the chair of council of the BMA, who was from Edinburgh, and not only will I not try to adopt an Irish accent, I won't try and get an Edinburgh accent either, but he said, "Oh, you can't tell me growing up in a cold home was bad. When I was a lad, we had ice on the inside of the window." I said, "Hamish, imagine what you might have achieved if you'd grown up in a warm home." Thank goodness presidents only last 1 year, you know, speaking truth to power. There are 3 causes of cold homes: the quality of the housing, and in the UK, we have one of the worst in Europe. Poverty. Real incomes did not increase in the UK for 18 years. We've not recovered from the global financial crisis. And the cost of fuel, which is 30% higher in the UK than the European average. Look at cost. If you're in the top 10% of income in France, you spend about 6% of your household budget on energy. If you're in the top 10% of income in the UK, you spend about 6% of your household budget on energy. If you're in the bottom 10% of income in France, you spend about 10% of your household budget on energy. If you're in the poorest 10% in England, you spend nearly 18% of your household budget on energy. That gap between the poorest and the richest in the percent spent on energy is bigger in the UK than in any other European country. If you're at the median income or below, you're spending 40% or more of your income on rent, 18% on energy, that's 58%. To follow the healthy eating guidance, you'd have to spend 50% of your income, if you're in the bottom 20% of your income on food. I think I'm up to 108% now of your income. If your child needs a new pair of trainers, forget it. This is a major crisis. How can you lead a healthy life like that? And children will suffer. After what I've been telling you, what's this strange animal called hope? Well, we've been taking action. We reported last month, I've been co-chairing a global council on inequality, AIDS and pandemics. We launched it in Brazil. I'm here with Winnie Byanyima, the chief executive of UN AIDS. My co-chairs, Joe Stiglitz, Nobel Prize-winning economist, Monica Gayngos, former First Lady of Namibia. And we got the G20 to put in a ministerial statement that to prepare for the next pandemic, you have to invest in the social determinants of health. It shows, I said, how far my life is diminished, that a marker of success is to be paragraph 15 in a ministerial statement from the G20. But still, we take what crumbs we can. Perhaps more persuasive. Coventry declared itself a Marmot city. Greater Manchester said, okay, if Coventry can do it, we'll do it. Build back Fairer in Greater Manchester. So we've worked with all these places. Altogether Fairer and Cheshire and Merseyside, Lancashire and Cumbria, Luton, a Marmot town, the London Borough of Waltham Forest, Leeds, Gwent in Wales. Say 50 plus, we're now up to 60 Marmot places. We're working for a national strategy in Scotland and 3 Scottish Marmot places. If I have trouble with an Edinburgh accent, forget North Ayrshire. I need an interpreter. Wales, we're going to start working with Wales for a national strategy. Scotland's got 3 Marmot places. Wales wants to have 4 Marmot places. I mentioned to colleagues this morning, I was in East Suffolk last week. They've just kicked off. So 60 Marmot places. Now, in the Republic of Ireland, the area around Limerick, have said, we want your help. We want to do it. And we'll see what else we can be doing. We've launched a big report that we did with Barnardo's a health equity collaboration for children and young people. We're working with industry, the community and voluntary sector, healthcare, and aspects of places. I mentioned that Joe Stiglitz, Nobel Prize-winning economist, co-chaired this high-level council on inequality, AIDS, and pandemics. My major achievement was getting Joe Stiglitz to accept that social determinants of health were important. Nobody knows that that was my major achievement, but I feel pleased about that. He gave me a copy of his latest book to read, The Road to Freedom. The title chosen advisedly because Friedrich Hayek's book was The Road to Serfdom, which kicked off the neoliberal era. And Joe Stiglitz is saying, it's over. Well, he didn't predict when he wrote this that we'd get whatever we've got now of techno-feudalism or crony capitalism or some ghastly combination of techno-feudalism and crony capitalism. But he was saying it's over. And what we need, is, he called it caring capitalism. I said in Europe we'd call it social democracy. Okay, but he's writing for an American audience. Here's another piece of fiction. When Keir Starmer was leader of the opposition and launched his health mission, on page 12 of the appendix, which everybody read, it said the next Labour government will amplify the approach of Marmot cities like Greater Manchester and Coventry by making England a Marmot country. Wow. Well, it hasn't happened yet, but we're working with Scotland and Wales, and who knows, maybe Northern Ireland. A Brazilian colleague, I was going around the world saying I was an evidence-based optimist, and a Brazilian colleague said to me, Michael, you're using the English language incorrectly, he said in his thick Portuguese English. You're not an optimist, you're hopeful. An optimist knows things are going to get better. A pessimist knows things are going to get worse. But hope is the opposite of fear. We don't know that things are going to get better or worse, but if we're hopeful, we can make a difference. We can work together to make a difference. Václav Havel, who was dissident playwright and then the first leader of post-communist Czechoslovakia, said hope is not prognostication, it's not a prediction. It's an orientation of the spirit, an ability to work for something because it's good, not just because it stands a chance to succeed. We're working for better outcomes for our children because it is the right thing to do. And if we're hopeful, and if we work together, it'll stand a good chance to succeed. Thank you.
Thank you for that fantastic contribution. I'm sure there are many comments and observations and questions from the floor. We have about 15 minutes and then the professor has to go and persuade our government and fill them with hope and that optimism. So I'm going to open it to the floor if you want to say your name, if you represent an organisation, and then I'll take a few and then I'll go back to the professor. Here.
Hi, my name is David Monaghan. That was a really fantastic presentation. Thank you so much. The main thing that I wanted to ask was, I know in Northern Ireland and the Republic of Ireland, there is an issue with intergenerational trauma with children, and how would you apply the Marmot principles in relation to tackling intergenerational trauma when so much of the time that trauma is stemming from a parent's experience of either the Catholic Church's domination within the country or in Northern Ireland in relation to the Troubles?
Okay, thanks, Miriam. Anybody else? Here?
Thanks so much. Thank you, that was fantastic. It's Alana Ryan from Pubble. We did an analysis of the census data from 2022 in Ireland, and we found that children who are in the most deprived areas are reporting disability rates, which are only seen in close to retirement age for those in the most affluent areas. So a really stark gap between the most deprived and the most affluent in Ireland. And I suppose part of what we were considering was the importance of place-based approaches. And I wondered whether you could elaborate on that, given your experience in England. Place-based approaches.
And one here.
Good morning. My name is Niamh Dial. I work for St Vincent de Paul as a researcher. That was a fantastic presentation. I also worked in health and social care in the UK from 2009 to 2021, so in the belly of the beast. So you took me back to a time and place, and you know, you talked about cuts. They felt intentional at the time, I can promise you that. But I was wondering, in terms of the graph around your expenditure, or the reduction in public spending, what was social care included in that? Because I couldn't see it, and I'd be interested on your take on that. But also the way in which the system treats people and waiting lists and all the consequence of that on people from deprived areas or those living in poverty. Can you see that? And have you got anything to add to that, I guess? And thank you.
Yeah, thank you for those questions. The question of intergenerational trauma is so important. By the way, it's Marmot, not Marmite, but you love it or you hate it. It's a serious question. Is key. Let me shift to a different tack. On visits to Australia, I try and engage with people working with Indigenous health. And the default position of child services for Aboriginal children is not whether to remove a child from the family, but when, with consequence, enormous trauma for those children and for the families, absolutely. And I was talking to a group of leaders of Aboriginal-controlled community healthcare organisations in Victoria, and they said, and I said, look, my understanding is it costs $100,000 a year to take a child into care. For $100,000 a year, couldn't you work with the families? Nobody thinks that leaving a child with an alcoholic, drug-using, violent man is good for children. But working with the families, and the leader of one organisation said, we're doing it. Because, you know, if you think about intergenerational trauma in Ireland, and particularly north of the border, it's a very important issue. If they can do it with Indigenous Australians, if they can say, we can deal with this problem, give us the resource and the political will, and we can deal with it. We know what happened post-World War II to Holocaust survivors. There was real damage. But working with them, understanding the damage, it takes will, it takes resource, and you're right to remind us of quite how important it is. I talked about adverse childhood experiences, but they damage people's lives, but they're not irreversible. The effects are not irreversible. So it's a key issue. To come to the issue of place-based, one of the reasons, now I didn't say to Coventry, will you become a Marmot city? They said it. I did go to Coventry and speak and give a lecture, but that was at their invitation. And the attitude they took was, if the national government's going to ignore your recommendations, then we can do it at the place-based level. And once Coventry did it, then I went to Greater Manchester. And in fact, Andy Burnham, who is the mayor of Greater Manchester, and he said publicly many times, he was Secretary of State for Health in the last Labour government back in 2010 when I delivered the Marmot Review. And he said publicly his biggest disappointment about being thrown out of office was that he couldn't implement my recommendations. And he said, we'll do it in Greater Manchester. I think he's got other ambitions now as well, but that's a different issue. We'll do it in Greater Manchester. And so there's a negative reason for working at the place-based level if national government won't do it, but there's a positive reason that local politicians are much closer to the reality of people's lives. People working locally are much closer to the reality of people's lives. So we're working with that. And I'd like national government to come in behind it, and I'd like that to happen in the Republic of Ireland, that we'd like to work with one or more places in Ireland. We're already going to be working with Limerick, and we'd like to be working with other places, but we'd like the national government to come in behind it. But it's very important to be working at the place-based level. In relation to the cuts in funding, let me just say another word about it. If you look not at life expectancy as we did, but at deprivation, then the more deprived the area, the steeper the reduction in funding. So I said that the central government support of local government went down by 59%. After 2015, local government could increase their revenue-raising power. Thousands of people have died of boredom contemplating the funding of local government, so I don't want to talk too much about it. But so the overall cuts were about a third. But the more deprived the area, the steeper the cuts. If we look at adult social care, the least deprived area had a cut of around 2%, and the most deprived area had a cut of around 16% in adult social care. So if you're living in a deprived area and you need help, we're going to take the money away so you don't get the help you need. That's what they did. So they could say, no, we weren't targeting sick people. That graph you showed that looked like we were targeting sick areas, it wasn't sick areas, it was just poor areas we were targeting. I mean, I said I'm not party political. One of those former chancellors of the Exchequer who became Prime Minister was filmed talking to the people of the wealthy borough of Tunbridge Wells saying, Labour took money away from rich areas and gave it to poor areas. I'm going to do the opposite. I'll take money away from the poor areas and give it to people like you. He said that, campaigning for the leadership. Well, they'd already been doing it. He was a bit late in the day.
We have time for another couple just before the professor has to. Any other comments or questions? Naomi? And then I'll come back to here.
Thank you so much for such a brilliant presentation and input. It really has sparked so many thoughts in my mind. I suppose today, we're really looking at not only about health, but also thinking about early childhood education and care. So I'm wondering, is there any work that you've been doing looking at the connection of wraparound services? So whether that's early childhood education and care, whether it's education as well, and how they might interact with some of the work in the Marmot places. Thanks a million.
And there's just one more here, sorry, and we'll do the two together.
Hi, Bernie Laberdine, National ABC Manager within PPFS in Tusla. I suppose you've talked about we have the evidence. We know that investment in quality early years services and supports gives the best outcomes for children. So what stops governments from that very long term? Because in that intergenerational poverty, it's not going to be a 10-year programme. It's not going to be a 20-year programme. It's a long-term commitment to actually changing that. So how do we persuade our policymakers and governments to commit to that?
Yeah, so early education and care, let me start with the outcome. If you look at the percent of children age 5 with a good level of development assessed in the UK at the end of reception year, the end of preschool, before they start school proper, what you find, not surprisingly, the greater the deprivation of the area, the smaller the proportion of children age 5 with a good level of development. If you take eligibility for free school meals as an indicator of poverty of family rather than the area, then what you find, children eligible for free school meals, a smaller proportion have a good level of development at age 5 compared to the average. Now it gets slightly complicated. What about how do children eligible for free school meals do in poor areas, intermediate or rich areas? I predicted confidently poor children would do worse in poor areas. And I was wrong. Damn. The data must be wrong. Speak truth. Like any good scientist, if the data conflict with your theory, you don't get rid of the theory, you get rid of the data. I mean, that's what you do. Well, I had reluctantly to admit that I was wrong and the evidence was right. But now we had to understand it. The greater the deprivation of the area, the better did the poor children do. What's going on? So we're working in Oxfordshire County. The poor children doing really badly in Oxfordshire. It's a relatively rich area, and the poor kids are doing really badly. In fact, we had a meeting of our advisory committee that I was chairing a few weeks ago, and our Oxford colleagues are really challenged by this. What on earth is going on? And in Tower Hamlets and Hackney in East London, hitherto poor areas, they're now very mixed areas because they're gentrifying, the poor kids do really well. They're very close to the average. So, for example, the gap in something like, don't quote the exact figures, but it's something like 55% of the average have a good level of development age 5, and 51% of the poor kids, the gap's 4%. In Bath and North East Somerset, the gap's more than 30%. In Oxfordshire, it's around 30%. Now, that's a real challenge for people living in rich areas, but given the hopeful person I am, I think, hang on a minute, we can improve things for poor kids. What those data show is that coming from a poor family is not destiny. We can improve things. Now, if you ask, well, what happened in East London? The Bangladeshi families say, we did it. We look after our kids. And the teachers say, we did it. We care for poor kids. If we didn't care for poor kids, we wouldn't have a job. I mean, half the kids are poor, so we have to. And the funding people say, we did it. The spending per child in London is bigger than in the rest of the country. It's probably some combination of all of those. The poor white kids are doing really badly. Really badly. But the fact that poor kids can do well, given the right circumstances, is really encouraging. And I think it does relate. We know in England, 1,000 Sure Start children's centres closed in the decade of austerity. We know that those can make a difference. I mean, the late evaluation of Sure Start, I was looking at it recently, 15 years later, the children enrolled in Sure Start did better at their GCSEs, at their national examination, than the ones not. I was talking to people from the Home Office about incarceration. Children who had access to Sure Start had lower rates of incarceration by age 15 already. Wow. And so that's early services making a difference, reversing the impact of poverty. And then we were...
Around government cuts.
Yes, so why the government... I was asked recently, when we were launching our Bernardo's report, what would you do if you were Chancellor of the Exchequer? And my comment was, I know, but the people of the UK don't know how lucky they are that I'm not the Chancellor of the Exchequer. I'd mess it up. I mean, exactly as you said, it's a long-term strategy. I'd hate to be the Chancellor. If you listen to what happened, we've just had a budget last week in the UK, and the amount of press and God knows what and speculation leading up to the budget went on for weeks. I'd hate to be the Chancellor. I, like a lot of other people, were hoping for something transformational, and we didn't get it. Because the right-wing press was criticizing them already before the budget even came out. You're going to raise taxes and you're going to, blah, 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 you're going to be ghastly stuff. And they're worried about reform and they're worried about the right-wing press. And I mean, it's ghastly. So why don't they do it? I mean, I think the previous government just didn't care. It wasn't a priority for them. They wanted to cut public expenditure. They were ideologically against state intervention. They wanted to roll back the state, so they didn't care. And they pandered to the rhetoric of equality of opportunity. And I say pandered to the rhetoric because this whole debate between equality of opportunity and equality of outcome is a false debate. Equality of outcome in this generation leads to inequality of opportunity in the next generation for the reasons I showed you of lack of social mobility. So if you say we want equality of opportunity, fine, then we'll get inequalities in outcome. People working in the financial sector will make mega salaries. People working at the low end of the service sector will have a decline in their income, big increases. In the UK, the 1% are now pulling away from the median. The median's looking more like the poor in terms of income. The 1% are pulling away. What does that mean for the next generation? That means inequality of opportunity. So to say I'm in favour of equality of opportunity, not equality of outcome, well, that means the next generation's going to suffer. And what we'd like is our politicians to think beyond the press reports of the budget 3 days later. Want them to think, as you said, for the next generation. And that's a tough ask, but that's what we need.
And on that note, I'm afraid I'm going to have to draw this to a close because we do have some politicians and some of our stakeholders waiting to hear from Professor Marmot. So it's really delighted that he was able to be with us. We're going to take a 5-minute comfort break now, so if you want to grab a tea and a coffee before our next round of speakers. Can I have a boulabus, please?